Hello, I'm Dr. Pinto, the Chief of Cardiology at the Holy Family Hospital in Bandra. We have started this department approximately 15 years back, but I've been a practicing interventional cardiologist for the past 30 years. We started this department because of the fact that Holy Family was a major hospital in Bandra, but did not have an interventional cardiology unit. Now we do all types of specialized procedures in the cath lab, the echocardiography lab, and the stress test lab that we have. In the cath lab, we have been pioneers in actually two procedures. One is trans radial procedures that we do from the hand, in which case we do not go from the leg or the groin, but we are able to do this procedure from the hand, making the patient go home in the same day within 4 to 6 hours time. And we are also experts for angioplasty, which means that we do angioplasty with stenting, and this is something which we started from the hand almost 15 years back. We've also added two new machines to our department. One is the IVUS, which is the intravascular ultrasound, and we also have the OCT. These are two imaging modalities that enable us to see the coronary arteries much better from within. And these modalities are not available in many of the hospitals of Mumbai. In fact, we are only the second hospital in Mumbai to have the OCT with angiographic co-registration. We also perform a procedure called as the FFR. This is a fractional flow reserve in which we are able to find a pressure gradient across any stenosis, in which way we reduce the number of procedures that need to be done on a patient. We have a fully equipped CT scan department to do CT coronary angiography as well. So very often our patients just need to do a CT coronary angiography and then follow up with us. We are actually pioneers also in electrophysiology. In fact, our doctors do a lot of electrophysiology work over here, which include putting of pacemakers, which also includes doing RF ablation for patients who have tachycardia, and also putting CRT and ICD devices which are used for patients who have got actually heart failure and who sometimes need to have electrical shocks given to them so that their heart rhythm is restored. We have been the institute that has started eye care. Eye care stands for care for everybody in the form of those who have sudden cardiac death. This happens very suddenly, many times in young people who fall on the road unconscious. They're not breathing and their heart has stopped, or in other words, their heart has gone into a rhythm which is shockable. Now, unless these patients are resuscitated and brought to the hospital quickly after they've been given a shock, then only can you save about 50% of them. Sadly, in our country, hardly 1% of these patients get saved because of a lack of education and because of the fact that we have not put enough AEDs. Holy Family, along with eye care, has gone ahead and installed 15 AEDs already in Bandra, and we are aiming to put 50 in Bandra so that people can be saved and then they can be treated. This is a project which we intend to spread all over the city and, if possible, give this information to the place all over the country. These are some of the few things that we have done, but we must also tell you about our non-invasive department. Our non-invasive department consists of echocardiography, transesophageal echocardiography, so on and so forth. We do a lot of dobutamine stress tests which are done in our department. Stress tests are done in our department. So we have the whole gamut of cardiology that is performed over here, and at very reasonable prices, which is very important. We are not a corporate hospital. We are a hospital that cares, and we give this kind of information, and we spread information, we spread education, and we have a lot of seminars. We have 6 DNB students with us who are taught over here, and these students, 2 at a time, 2 every year, will pass under our whole list of cardiologists that we have attached to this hospital. We are also pioneers in rotablation, which is a technique that is used to open up arteries by cutting through calcium. These are some of the important things which I have told you. But most of all, I want to tell you one thing. Holy Family is a place that cares. It cares for its doctors, it cares for its nurses, and it cares for its patients. Thank you very much for listening to me.